and emotionally. How do you, as a parent or teacher, help your child navigate these issues as they arrive? Where do you turn for help? What should you do? Well, today I have an amazing clinical neuropsychologist and clinical professor who specializes in the assessment of neurodevelopment disorders in children and adolescents. And she is going to help us answer those and many other questions. It is my distinct honor to welcome Dr. Karen Wilson.
Thank you so much for having me. And I love that story. I can't tell you how many children I've worked with who've experienced very similar things.
Yeah, I know. I thought I was a one-off, but unfortunately happened to me, happened to my child, keeps happening, and I'm just not quite sure what we should do about it. But Dr. Karen, it's just so wonderful to be able to spend time with you. You know, we're really honored that you could take some time out of your busy schedule. So before we get started with lots of questions, would you mind sharing with everybody a little bit about who you are and what you do and how you came to where you are now in this amazing organization that you have founded?
Oh my goodness, this will take forever, but I will keep it short. So I'm a pediatric neuropsychologist, which means, you know, I have a degree in clinical psychology with a specialization in neuropsychology, which is the study of the relationship between brain and behavior. And I actually started my work in dementia. I was doing evaluations on elder individuals who are trying to figure out, whose family members were trying to figure out whether they have memory struggles that would be expected for their age, or were they developing a dementia? And I was doing a rotation on my internship in a pediatrics and just fell in love with working with kids and just never turned back after that. I just figured, I just saw the opportunity to really support kids at an early age and impact the trajectory of their lives. And so that's how I ended up working in the child space. And I've been doing evaluations for going on 17 years. So I've literally evaluated hundreds of children who've presented with a number of different areas of struggle and helped to connect those kids and their families with hundreds of professionals who have helped their kids thrive. And I think about, you know, if they had not come in for the evaluation and not connected with the right educational specialists, speech and language pathologists, you know, clinical psychologists, and even educational environments that support the way that they learn, you know, their lives may have been very different. And again, just the opportunity to support them in that way has been just so rewarding. And about 2 years ago, I just found that there were so many parents that still had misinformation about the struggles that many kids face, kind of what you described in your story about reading. And because when kids struggle, it can look so different in different kids. I've had parents or teachers say, well, it can't be dyslexia because they can do X, Y, and Z, or it can't be ADHD because they can play video games forever. And all of that is misinformation. And so I thought there's got to be a better way to get more information into the hands, more reliable information into the hands of more people, and then also connect families with individuals who can do really great work with kids and help them to overcome areas of struggle and get the support that they need in order to thrive. And so what I did was I started meeting with my fellow clinicians and educators. And what I did was I created a web platform where parents can go to get information about different areas of struggle. And then on the same platform, connect with professionals who can help. And so what parents can do if their child is struggling, they can search for their child's area of difficulty, attention problems, reading struggles, social difficulties, anxiety, depression, read about that, listen to a podcast episode about that topic, and then they can search for a provider who can provide services and assessment or support in that area, and even connect with schools who might be a better fit, that might be a better fit for their kids. And so we just started during the pandemic, and we're really excited about growing.
I think what you do is just like phenomenal, because I'm constantly meeting parents who don't know what to do. You know, they get a diagnosis for their child, and then it's, well, what do I do with that information? You know, thankfully here at Bridges, when people find us, you know, it's a case of, oh, finally, there is a community of people that can help me. But what do they do before they get here? And for a lot of people, you know, they don't find us for a long time.
I know.
One of the things that we wanted to talk about today, particularly, is children's social and emotional needs. And so I was wondering if you could just give us a quick overview of what that is, so that anybody who's listening that's not quite sure with the jargon, because we're forever coming up with new words to describe everything, which is great. But could you just quickly explain what we mean when we talk about a child's social and emotional needs?
Yeah, I think we're talking about the way that children interact with their environment and the people in their environment, and how they process and understand their own emotions and the emotions of others. And so that's a big, broad term, right? It has to do with recognizing that what you're feeling, what that feeling is it anxiety? Is it nervousness? Is it stress? Is it sadness? Is it disappointment? And then being able to regulate those emotions so it doesn't come up like a big, huge temper tantrum or emotional outbursts. And then also being able to talk about what it is you're feeling and to problem solve. Okay, I'm feeling really anxious right now. How can I, bring that anxiety level down? What are the thoughts that I'm having that are contributing to that anxiety? And then what can I say to myself instead that would make me feel better and calm down? And then it also has to do with your ability to interact with other people. It's about what you say, how you say it, when do you say it, understanding, that there are different things that people say. Sometimes they're being very literal. Sometimes they're joking. They may be using figurative language. It's processing all of those at the same time you're interacting with your environment. So what I often say is that I'm often working with kids who think, learn, or experience the world differently. And some of that experience in the world differently is experiencing the way you interact with other people. For some, it's just it's a social discomfort with being around other people. Sometimes there's a co-occurring language-based issue where they just don't know what to say. They don't have the right words. They don't come out the way that they intended. It's not organized. It's not sequenced. And so there are a lot of factors that can go into how you interact with other people. And it has a direct impact on how individuals feel about themselves. So it speaks to their own self-concept as well.
Nice. And then, and I think also, in addition to how they feel about themselves, doesn't that then also affect how people perceive them?
Absolutely. Absolutely.
Yeah,
absolutely.
Because I'm concerned that for a lot of my kids, because they are unable to articulate how they're feeling, they're unable to describe the stress or the anxiety that is literally tearing them up at that time, that they're then perceived as either distant, standoffish, they don't want to do the work, and that it's often comes then with a negative connotation and a negative description of who this child is. And
absolutely. And some of it has to do with being able to put yourself in someone else's shoes. And sometimes, part of that social emotional, functioning is being able to get out of your own head and what you are thinking about, to then think about the person that you're interacting with. What could they be thinking? And then responding to them in an appropriate way.
Right. And so for non-neurotypical children, is that harder than for a neurotypical child to try?
It can be. There's such a broad spectrum of kids who are neurodiverse, and they have different challenges. That's often why we do assessments, because we don't know, is this a social difficulty that's connected to a language issue? Is it connected to social perception, social cognition, or is it an attention issue where you're having a conversation with someone, but you're thinking about what you want to do after school, and you're acting seemingly inappropriate to the person you're having a conversation with? You may not seem very interested in what they're saying, but you are not paying attention. And so, people can present with the same struggle and present the same way behaviorally, but have something internally going on that's very different than another person who's presenting in a similar way.
Yeah. one of my favorites was one of my students. The teacher would constantly complain that he didn't seem to be paying attention because he wasn't looking at her.
Uh-huh.
And so I'm going, well, did you ask him any questions about what's going on in the class?
Mm-hmm.
She goes, well, he wasn't listening. I said, well, how do you know he's not listening?
Mm-hmm.
Well, he's not looking at me. So I'm going, but he may not be comfortable looking at me.
Right, absolutely.
Right, talking to him about what's going on and finding out if he's actually retaining any of the information. And the upshot of that was when she actually started to engage with the student, she found out he heard everything that she said, understood everything that she said. It was just his inability to sit and stare at her like a few of the other children were able to do. So his comfort zone didn't allow him to sit deathly still and look at her, but he was looking over there, and it appeared that he was watching other things, but he was listening and paying attention. And so that came as quite a surprise to her. So I'm going, yeah, you know, people can do that multitasking thing.
Right.
People tell you that they can't. I'm going, but I multitask all the time. But I'm told I'm not supposed to be able to. I'm going, yeah, my brain thinks differently. It does other things. So assessment.
Yes.
You mentioned assessment a couple of times, and assessment, I think, is really important because that's the way that we find out what's going on, right? So I've worked with students who've had IEPs and 504s, which have been really great at identifying where they have a challenge, but they don't really address any strengths or anything else. So I know you do lots of assessments. Mm-hmm. So could you talk us through like the kind of assessment that's really, that you would recommend for 2E students, and maybe that's what parents should be trying to get?
Yeah, absolutely. And I think, you know, when we think about assessment, oftentimes people think that, you know, we're doing assessment for the purpose of getting a diagnosis. And that's actually not the reason why we do evaluations. You know, during the process, we might end up with a diagnosis, but that's not the purpose. We go in really seeking to understand why a child is struggling, right? And like I said, kids can struggle for a number of different reasons. And the reason why we want to understand why they struggle is because then once we know why they are having difficulty, then we know how to support them, right? When you talk about, you know, a child who is having struggles with, for example, I often use the example of reading comprehension. If you don't understand why that child is struggling with reading comprehension, you have no idea how to provide the support. Some kids struggle with reading comprehension because they have difficulty paying attention. They are not paying attention to the information on the page. They're skipping every other line. They're looking out the window. They're getting distracted. You ask them a question and they just don't know. They can't answer it. Other kids have to have such a hard time getting through the phonological processing that extent becomes exemplary, you know, this becomes there, and the whole paragraph doesn't make sense. And so it's really rooted in phonological processing. For some kids, it's receptive language. They can read beautifully, fluently, they can pay attention and focus, but when you ask them, they just don't understand what the passage meant. And so those are just 3 examples that if you don't know where the reading comprehension issue is, how do you know whether you have to intervene with the attention realm, whether it's, you know, a reading comprehension intervention, is it a language-based intervention? You just don't know. So again, the purpose of doing an assessment is to understand why a child is struggling, and then also understand what does this mean in the context of the child's broader cognitive profile. And that's where it really comes back to those strengths and weaknesses. We don't only want to know where a child is struggling. We want to know where are their strengths. Where are the strengths of this child? Because if the child is struggling in one particular area, the strengths help them compensate for areas of weakness. So kids, for example, and I saw this with an evaluation I did recently, where this child is now well into middle school and having struggles, had no difficulties prior to this point, but there was always some suspicion that there was an attention issue. But it wasn't until middle school that you got to see that this is really manifesting, because this child had an exceptional memory, visual and verbal memory, where they were like if there's a gifted range of memory functioning 145, they had that. So they were compensating for attention issues in elementary school with an exceptional memory. But it wasn't until middle school, where now you have the demand for executive functioning and higher focus is needed, that things began to fall apart. And so we want, when we do an assessment, to go in looking for a profile of strengths and weaknesses. That's what you get in an assessment. You may get a diagnosis, but what you're really looking for is to understand why a child is struggling and get a profile of their strengths and their weaknesses. And so the type of assessments that I do are neuropsychological assessments, which is, again, looking at the relationship between the brain and behavior. So I'm looking at testing through the lens of a neuropsychologist. What does this tell me about the way this child's brain is organized based on my understanding of neuroanatomy and neuroplasticity and all of the information that I know in my training? And so what I'm going to do is I'm not just going to look at reading, writing, and math, which is going to tell me where they are in their academics. I'm going to look at all of the processing issues that impact reading, writing, and math. So I'm going to look at attention. I'm going to look at memory. I'm going to look at not just memory, but memory for things you hear versus things that you see, because those are processed very differently in the brain. The same is true for attention. I'm going to be looking at language processing, your ability to understand what you hear, and also being able to express the way, express your thoughts and ideas so they come out the way that you intended. And all of that information together will give me that profile of cognitive strengths and weaknesses. But I'm also going to look at social emotional. We started there with social emotional functioning, because sometimes what you think is a problem with attention and forgetfulness can be anxiety and depression. Mm-hmm. Because people who are very depressed have problems with attention and focus, and they're also forgetful. Same is true for individuals who have attention issues. And so we want to know, are these difficulties with attention that we're seeing, these lapses in attention, is this an ADHD or is this anxiety? A kid who's so focused on their worries and their nervousness and their fears that they're not paying attention, right? Anxiety and ADHD are going to have completely different treatment plans. So unless you do a deep dive into understanding why the child is presenting in that way, you will not know how to support that child moving forward. Does that make sense?
Oh, yes. Oh, yes. Thank you. I think that's the best way I've ever heard it explained. Thank you so much.
You're
that's
so
wonderful.
welcome.
So our students then really do need a neuropsych evaluation. So then the first question is, where do they get one of those from? And how do they get one of those?
Right. And that's a good question. And I would first say that they don't need a neuropsychological evaluation. Some people do very comprehensive psychoeducational evaluations that have all of the tests that we would give as neuropsychologists. But if they're not trained as a neuropsychologist, they can't call it a neuropsychological assessment. So you can have two assessments that look identical in terms of the tests administered. The interpretation might be a little different based on the person's training. So it's really looking at what domains are being assessed as part of that evaluation process. What does that evaluation process look like? That's really where you want to pay attention. Obviously, if kids have risk factors neurologically, like low birth weight, exposure to toxins in utero, seizures, things like that, then you're probably going to want, you're definitely going to want a neuropsychological assessment as opposed to a psychoeducational. If they've had head injuries, loss of consciousness, all of those things where it kind of complicates the cognitive profile, then you're definitely going to lean more towards a neuropsychological assessment. But so it's really about what domains are being assessed in that evaluation. And oftentimes, again, two evaluations are also going to look at intellectual functioning, right? When we think about looking at kids who are gifted, that's often for a lot of schools who are enrolling kids who have gifted profiles are looking for an IQ score that's in a particular range. And so the IQ is part of that assessment process that's typically done. In terms of where you can get those assessments, there's a number of places. You can go and get that type of evaluation done privately, seek out neuropsychological assessment in the community. There are also medical centers. Many medical centers have neuropsychology divisions or medical psychology divisions in their hospital settings or their medical centers, where individuals can go and get them done there. And sometimes what you'll need, depending on your insurance, is a referral from your pediatrician saying that this is needed to better understand the struggles that a child is experiencing. So it's worth it for a parent to check in with their pediatrician to see if the pediatrician can make a referral for a neuropsychological assessment through their health insurance. There are also clinical psychology centers in psychology departments that have doctoral programs, because that's how the doctoral trainees get their experience and get their training. And so they're usually supervised by a licensed clinician, and you can go there to get an assessment done. And you can usually get it done at a reduced fee because students are administering it, yet they're supervised by accomplished clinicians, right? And so that's another place you can go. You can go to a lot of these schools who have doctoral programs in psychology, and they usually will have psychology clinics. And then you can go there to get assessments done.
I love that. Love that. So is that first place then for the parent to go when they have a concern to speak to their pediatrician and discuss what assessment your child might need? Because they may or may not have a diagnosis. So if they haven't got a diagnosis, do we need the diagnosis first, or do we need a full assessment first?
Yeah, and usually when you're going into assessment, you don't know what the diagnosis is. That's why you're doing it. But they may have a considered diagnosis, right? Something that they are thinking based on the clinical information that you're presenting to your pediatrician, what they think it might be. And so oftentimes that's needed, right? You need to determine what kind of diagnosis do they think this child has to then go forward with a full evaluation.
Okay. So when I was in Louisiana, a lot of my students had a 504 or were able to get a full-on IEP, but they didn't always have like a full neuropsych because their parents couldn't pay for those kind of things. So, but if we already kind of have a diagnosis, it's definitely still worth going back to the pediatrician and trying to get a deeper assessment so that we can find out where those strengths are.
Absolutely, because particularly if a child has a diagnosis, but they're still struggling, right? There might be something that was missed, or the intervention, the treatment plan is not working, and we want to understand why. And that would be another reason for doing an assessment.
Cool.
Something in a more comprehensive way.
Because I did work with children who the IEP just made no sense to me, because the child that was presenting in my class do all the stuff that's on their IEP, but it wasn't helping them.
Right.
You know? And I'm going, there has to be more. And so we're having to have arguments with people who in IEP meetings going, no, Fred needs this.
Absolutely.
You know, Fred could do this.
Right. And what's interesting is that I think the research shows that children who have, the 1/3 of children who have one diagnosis will meet criteria for another diagnosis. So oftentimes if you have one diagnosis and you've only assessed for that particular diagnosis, chances are you're missing something else that's co-occurring. And that may be why the child is not responding in the way you would expect to their treatment plan, because you're treating only the attention and you're missing the anxiety that's co-occurring, or you're missing the co-occurring dyslexia, right? Yeah.
That makes so much more sense now, because I'm going, yes, so a lot of my students, they have, my former students have just had like one solid diagnosis. Kid's got ADHD. I'm going, okay, you sure that's all that they have? No, so because it's later transcribed that like some of my kids can't see, they need glasses. I'm going, just simple things that would help make life a little bit easier. You know, I'm going, well, did we do full-on tests? We discovered one of the boys in my class wasn't hearing properly, and you know, and so eventually needed a hearing aid. So it's definitely worth encouraging parents, particularly, to make sure that we go in for a full overall and explore. So if they have one diagnosis, please go have them check out, because there's probably something else going on if your child is not thriving. Because I definitely like that notion of trying to get our kids to thrive rather than just survive.
Right.
Because I think particularly those children who are depressed, it really is, they're barely surviving, right? And so that depression is just eating away, and we're not addressing it. And so the poor kid is just barely hanging in there, and nothing is being done to help move them forward.
Right. And the other thing is that some of these difficulties can manifest differently at different ages. And so, you know, a child who's had an ADHD diagnosis in second grade, and you're like, okay, now we're going to give them preferential seating. We're going to break up tasks into smaller chunks. We're going to maybe prescribe medication. You're not done because when middle school hits, like I gave that example, now you're going to have executive functioning difficulties, which frequently co-occur with ADHD that just doesn't manifest until the demands for executive functioning increase. So when kids get older, then you realize, okay, why is the medication not working anymore? Why is this preferential seating no longer effective? Well, it's probably because now they need support for planning and organization and time management and decision making and prioritizing and shifting their focus from one thing to another, and metacognition. All of those things are part of the executive functioning umbrella, but they typically don't manifest until a little bit later, until the demand for those increases in their environment. And then you might see kids who now start struggling with some emotional regulation, where they have these big outbursts and there's temper tantrums. Well, emotional regulation is part of the executive functioning system. And so we want to understand how to support them in that way, not just help them to pay attention in the classroom.
Right. Because it's funny that you say that, because a lot of the conversation, and I'm not slamming teachers because most of my teachers got 30 kids.
I love teachers.
Right? Poor people have got 30 kids in their class, and they're trying to meet all of the needs of all of their children, but they're trying to get a child to be compliant. And so, as you said, as the child grows and the workload grows or changes, their reaction to that environment changes as well. So we need to be aware of those additional needs. For a lot of our children, they've changed their medication, and we have times when the medication is just like crazy. But is there a particular time, a particular age that we should definitely, as parents, be saying, going back to our therapist, our pediatrician, our psychologist, and saying, my kid is about to, so for instance, my kid's about to go into middle school. So in elementary school, everything has worked fine. They're about to go into middle school. Is it before they go into middle school that we should start to look at where they're at and what they're doing? Or do we need to wait until they're in middle school and struggling to then reassess or look at?
Right. That's a really great question. And I would say it really depends on the kid and the school that they're going to. Some schools do a really great job of preparing kids for that transition, right? Where they scaffold a lot of the things that they're going to have to do. And then the kids, even those with ADHD, don't struggle. But if it's a significant jump and they're not adequately prepared for it, then things can fall apart. So it's worth kind of asking, well, how are the demands in middle school going to be different than they are right now from a child? How are the expectations going to be different? What is expected of them? If you know that your child is going to have to navigate 4 different classrooms, they're going to have, an hour more of homework a night. Those are things that you can start thinking about, because you know your child's ability to stick with a task and to move around and to be independent. Sometimes it's a question of independence. And so then you start having those conversations with, the middle school teachers that your child will be having, or going back to your pediatrician and saying, now might be a good time to do an assessment, because I'm concerned based on what the school is telling me that my child is going to have some difficulties with executive functioning. I've already seen some of these struggles at home when the school homework has the homework demands have increased. He's still having difficulty kind of shifting from homework to non-homework related tasks. So, again, keeping an eye on what you've been observing at home, get information from the school in terms of where your child's strengths and weaknesses lie, and how will that impact them as they transition to middle school. So having those conversations with teachers, having those conversations with your partner, making observations of your child at home in terms of what they're able to do, all of those things will help you determine whether or not it's time to get a reevaluation. But so I never say across the board, everyone transitioning to middle school needs a full assessment, because it's just not true.
Beautiful. Thank you. So there's two things that you said that I want to pick up on.
Okay.
Independence and observations at home. So let's start with the observations at home. So you mentioned that the parents need to be observing how their children are in the home environment, and then they need to then share that with the teacher, because I've had children who present very differently in my classroom to the way they present in their home. And when I've said to the parents that, Johnny's doing a great job of doing this, this, and this. I had a kid who loved to help people. So when he was at school, he would volunteer to help tidy up and stuff. And when I told his mom what a great job he had done helping and assisting his classmates, she said, you do know my child's called Johnny, looks like this. Da, da, da. I'm talking about. She's going, no. In our house, this child drops everything, steps over it, and walks off.
Right.
So they're two completely different people based on the environment in which
and that's not unusual. That's not unusual. Schools are more structured. There's cues when they're going to be shifting from reading to writing to PE to recess, right? And those structures typically aren't in the home environment. They come home and there's not, now we're going to transition to homework. Some parents and some households do that better than others, but there's typically less structure at home than there is at school. And also the incentives are different at school than they are at home, right? And so you might be incentivized by your peers, how they perceive you when you do certain things. Your teacher perceives you. And sometimes when the kids get home, they're just tired. They've been on all day at school and now fatigue is set in. And so, they may not be as well regulated. They're exhausted. Sometimes for kids who are on medication for attention, the medication is worn off. And so they're going to behave very differently.
Definitely. Yes. My baby's definitely. So, but then the other thing that you mentioned was their independence.
Yes.
And for parents, encouraging the independence of your children can really be difficult, because obviously we want them to be successful. I mean, you control what they do more in the home, obviously, than in school, because you're not in the classroom with them. But how, as a parent, can we help our children be more independent without becoming just a nag and a complainer? Is it standing behind them and constantly saying you've got to do, or is there some way to encourage and support their independence without turning into, that moany complaining person?
Right.
Looking at them.
Right. It's a number of things. One, it's about knowing your kid and knowing, what will be something that they are able to do. And then obviously you want to kind of increase the demand and the challenge with tasks so they become successful at it. But it also takes a lot of patience. If you've ever had a child who's just learned to tie their shoes and you're trying to get out the door in the morning to get to school, you want them to try, and they want to show you that they can do it, but it can take a long time to tie those shoes. So, it takes a lot of patience to not jump in there and just, let me just do it. Right. And that's what parents, especially when there's a time crunch and that I have to get to school. We don't want you to be late. There's going to be traffic. So it takes a lot of patience on a parent's side to really let your child do something, because it's always easier for you to jump in and do it yourself, right? Because particularly when kids are just learning, think about a teenager when you're teaching them how to do laundry, and they're trying to figure it out and they're asking a lot of questions, it's easy to say, oh, let me just do it, right? But you want them to develop that independence. That's a skill that will help them when they go off to college, right? And so you want to start small, start with one thing at a time, let them develop some competence and lots of positive reinforcement. Even if they don't do it completely the way you would or completely accurately, you want to reward the attempt, right? It's not like, oh, you did a great job at this. You worked really hard. You just want to reinforce the attempt, the behavior, because that will help them to continue to try and motivate them to continue trying.
I love that. I think that's brilliant. Reward the attempt, because often they don't get it right.
Right.
And
absolutely.
So you can't tell them they did a good job.
No.
Because they know you were lying.
Absolutely. You say you worked really hard at that. Last week it took you 20 minutes to tie your shoes. It only took you 10 minutes today, right? It's like, that's fantastic.
That is great. So that's it. It's the encouraging and rewarding the attempt and constantly praising them in that department. Mm-hmm. And then building, I guess, into your schedule and allowing them time to do it.
Absolutely.
So I guess we've all got to get up a little bit earlier. We know it's going to take 20 minutes
yes.
to tie these shoelaces at the door. We've got to build that 20 minutes into our schedule so that we can spend 20 minutes doing that.
Right.
Oh, yeah. Yes. So, but then when you're juggling 3 and 4 kids, that's kind of
it's tough,
right?
It's tough. I mean, I know that I get up sometimes at 5:45 because I know that, I got to give my kids time to do their things. And some things are not going to be in the right place. Or I forgot to tell you I needed the shirt ironed. Things are just going to happen. If you have the built-in time into your schedule, then if you need more time, then you have it built in and you're not, having to scramble, and then you get dysregulated because, you're not able to do things that you wanted to do for yourself.
Cool. So 2 questions just popped up.
Okay.
I think one we kind of answered, but let me just ask it again, just so you can clarify. Should an assessment be redone at different ages?
It depends on if a child is struggling. If they are responding beautifully to their educational plan, to the therapeutic interventions, whether that be psychotherapy, behavioral therapy, medication management, then they probably don't need an assessment right away. Sometimes for schools, they may need a reevaluation to determine if you still meet criteria for accommodations. So that would be a different reason to do the evaluation, even if they're doing well, right? And typically you want to do an evaluation when you see a child struggling, no longer responding to the intervention, or struggling in another area where they weren't showing area of difficulty before.
Oh, that's beautiful. Thank you so much. Another question, how can we help gifted children, including 2E kids with socialization problems, and 2E adults for that matter?
Yeah, I think it's about getting the right support and educating yourselves. I mean, there's a lot of great material out there on social thinking, right? There's a lot of really good information about social emotional learning and social cognition. And so doing your own reading will help, but then getting kids who are really struggling socially into evidence-based social skills groups. The Peers program that was, I think, founded at UCLA is a great intervention for tweens, for teens, for young adults who are struggling socially. And so it's really seeking out those resources that will help them and then educating yourself at the same time.
And you said it's evidence-based social skills groups.
Right.
because we know that there are a lot of those social skills groups out there, but if a kid's just doing one-on-one with the teacher or 2 other kids, what we've noticed is that then doesn't transfer to a space with other kids.
Right.
So how would the evidence-based one be different to that?
Yeah, it's basically the idea that there's research to support that this works in improving social skills. in natural settings, right? You don't want it to be where they show improvement in the group alone, where last week you came to the group and now you're better than you were last week, but in your school environment, on the playground, on play dates, right, it's not manifesting in that way, right? You're not seeing that generalization to real world situations. And so that's why we talk about wanting to make sure that we're using evidence-based. So the research supports the idea that social skills improve with this type of intervention.
Brilliant, thank you. What if no treatment intervention exists? How do I know as a parent if a new assessment is needed?
If no treatment exists or it has not been effective?
I'm not sure.
Okay.
Ava, would you mind typing a little bit more info so that we know? So does the child have no treatment and interventions at the moment, or they've just not been identified as needed? Right. So if you wouldn't mind just typing that in, and then we can address that for you. In the meantime,
yes,
I was late opening the link. Oh, okay. I'll read that one in a second. So pediatricians are the front line, but they usually don't have training in giftedness, 2E, or asynchrony. How do we find ways to educate them who don't even know they need it?
That's a really great question. I wish that we could, whatever conferences that pediatricians attend, I think that people in this space and who do these evaluations and who work with these kids need to get there and present the information and present the research to those groups. I mean, I think the same is true for a lot of neurodevelopmental disorders. There's a lack of understanding about executive functioning, about how ADHD presents in different kids, depression, anxiety. I think there are a number of things that aren't emphasized in a lot of medical programs. And that's what I've heard from other physicians.
Right. So we've got to try it. So maybe it's more people like you and I offering training for medical professionals. So maybe that's a field that we need to be exploring more, because she's right that you know, if they don't know what they don't know until they need to do it. But that's not helping our babies. How to enforce long COVID guidance when no one takes your child's diagnosis seriously, including his IEP case manager. I'm not sure what long COVID guidance.
Unless it's a child with symptoms related to COVID, maybe. I'm not understanding, but definitely I would, if that's the issue, I would definitely get a physician on board to document the long COVID symptomatology and how it impacts functioning and can exacerbate difficulties with attention, focus, memory consolidation, all of those things, processing speed, particularly when there's a fatigue factor. So again, probably going back to the pediatrician, we're putting a lot on the pediatricians, but going back to the pediatrician and getting documentation of that long COVID exists and how it can impact functioning.
Oh, that's great. Yes. They even ceased his home tutoring without notice. Yeah. So that's the same person. So definitely, I think we need to go back to the pediatrician and get some documentation to bring back into the school to prove why the child needs the accommodations that they should be getting. Okay. One of the last questions. Oh my goodness, where did the time go?
I know. I just looked at the clock and I'm just like, really? We've been speaking for 50 minutes? And I feel like there's so much more we could say.
Right. Yes. We've barely touched the tip of the iceberg.
You're just going to have me back.
I was just about to say, would you be up for coming back to continue the conversation? Because there's just no way in this little short space of time that we can hit it. So clarification. I live in Switzerland. 2E doesn't exist here. We were told to leave private school. There are no gifted programs here, and no one has ever heard of 2E. I'm trying to self-educate So yes, that helps. So the child isn't getting any treatment or interventions because the parent can't get them to identify the child's need, because in Switzerland there's no procedure for that.
Right.
So she wants to self-educate. And so she's looking for, what does she do? How does she know if a new assessment is needed? I would say that, was that definitely a pediatrician conversation again?
Yeah, it definitely. And I don't know the school systems in Switzerland, so I don't know if you could request that through the school. I'm not familiar with their school system, particularly if a child is bright but still struggling, because again, 2E presents as asynchronous development, where kids some things come very easy to them, but then some things are a little more challenging. And so if your child is showing this discrepancy or this asynchronous development, then it would warrant a look at why they're struggling in particular areas. But again, I don't know what the procedure would be in Switzerland, but I always encourage parents to bring information to teachers. Sometimes parents, when I was at my kid's school, the school invited me to do a talk on language development. And so maybe you can propose that to the school to bring someone in. Now we can do so many things virtually to do teacher education on 2E. And so particularly if you get a school who's receptive to it, then it's really beneficial for everyone.
Yes, she says nothing is done for gifted. So you definitely, I think Dr. Wilson has a really great point. If there isn't anything there available for gifted because of the pandemic, a benefit of the pandemic, so that we've discovered that we can do lots more things online. Yeah. Ava, reach out to me, email me, and our school does training for other schools. We do have resources. Also, Dr. Wilson with Nexus has information and links to other schools. We have a lot of children now doing school online. So please email Dr. Wilson and myself, and maybe we can connect you with some of those organizations who would then be able to help, so that you're not having to do all of the education of your child all by yourself.
Absolutely.
Yeah, so there are so many new online programs coming on, which are actually geared for 2E students and the gifted. So between the two of us, we can definitely point you in the right direction. For sure. And help you figure that out. So so please reach out to both of us and let's give you some information. Yes, Dave, I am about to provide an email address. So thank you so much. And yes, that goes for everybody else. If there is a way that we can help you, please most definitely reach out. I think, yeah, we've got barely 8 minutes. So just before I give out all of that info, but Dr. Karen is at Nexus, childnexus.com. So you can reach out to Dr. Karen there. And my email here is crucialconversations@2ecenter.org. And you'll be getting an email with the link to this episode, and feel free just to respond to it. It will come to me. So Dr. Karen, just before you go, are there any particular guidelines or just like one little tidbit that you can give to encourage our parents for how they can socially, emotionally support their child or their adolescent child? Just like one last tidbit just before we lose you.
Yeah, absolutely. There are a number of things that parents can do. I think one of the main things you can do is to continue to establish connection with your child, small child, adolescent, because connection has a really significant role in just social and emotional functioning, right? If you feel connected to people, human beings, you feel valued for who you are and the uniqueness of who you are, that really can make a significant difference in terms of how that child, that adolescent feels about themselves. It can buffer against the stressors of the world, and we know that there are a lot of them.
Yeah.
And then also can buffer against feelings of anxiety and depression. And it makes them feel safe and secure to share their experiences with you. And by doing that, it helps them to be more confident that support is available when they need it.
Beautiful, thank you. And then for our poor beleaguered teachers who are out there at the chalk face, struggling with too many children in their class, is there, one piece of advice for them for how they can also help our children social emotionally regulate?
Yeah, I think it's setting the tone for the classroom of acceptance, of being flexible. Sometimes kids are tired, and recognizing that sometimes that you may need to do things a little bit differently. Sometimes you need to take the class outside rather than staying inside the classroom. Sometimes you need to just have a mindfulness break before you jump into something that's going to be, require a great deal of cognitive load. And so it's really kind of reading the room and seeing how the students are feeling, what they're experiencing. There's a lot going on in the world, things they might be worried about. Being willing to say, you know what, we're going to put math off for a while, and let's talk about some of the concerns that many of you have been talking about, with the situation in Ukraine, or about something else that might be on their mind. And so it's just being in tune. And again, that shows connection, right? It shows that you're paying attention to what it is that they're experiencing, what they're feeling. And that, again, that safety and that feeling of being heard is really powerful.
Most definitely. Oh my goodness. I can't believe you're leaving me. You're
For now.
Okay.
For now,
All right. Okay. So I cannot thank you enough, Dr. Wilson. It has just been an absolute delight. We have all learned so much, and I already feel empowered to go do some things today. So my deepest thanks for you taking.
Thank you for having me. It's been a pleasure.
Yes, it's been wonderful. So sorry. So I was going to say for the people listening in, John has popped into the chat some things, some resources that Dr. Wilson recommends. If you look at the bottom of the chat, where the smiley face is, there is 3 little dots. If you click on that, you can save the chat, and it will then save all of those resources. However, we're also going to post them on our website along with the recording. So if you miss that, you will definitely be able to find it on our website. So it's been a pleasure helping everybody find answers to the questions. I hope that they too have been inspired to use the recommendations for Dr. Wilson. And I know that she will definitely be delighted if you choose to reach out to her. And as I said before, childnexus.com. Please reach out to Dr. Wilson. Child's Nexus is absolutely phenomenal. The resources and the people that she has gathered together really is, it's wonderful. So it's a fantastic resource for everybody. If today's conversation has made a difference to you and you would like to share with me how, please email me. My email is crucialconversations@2ecenter.org. You'll shortly see a survey pop up on the screen, and if you'd like to complete it, we would be very grateful. Your input into our conversations helps us to make sure that we keep them relevant. I can promise you Dr. Wilson will be back, because I know we have so much more yet to learn from her. I'd also like to say a special thank you to my amazing team who are in the background, and that's John and JT. Their patience, their hard work, and their expertise, without them, this webcast would never happen. And also Stephanie. So we'll resume Crucial Conversations about Cognitive Diversity on May 18th. My guest will be educational therapist Rachel Kapp of the Kapp Educational Group. So we'll be talking about how executive functioning skills are at the root of everything. So if you have questions about executive functioning, make sure that you join me. Thanks again, Dr. Wilson.
You are welcome.
So John will pop it's going to flip any second. Or maybe it won't. There it goes. Yay.